Good afternoon. I'm Dr. Duke Majan at the Duke Spine Institute. You are watching live broadcasted spine surgery. Our patient is a dentist. He's from Florida. I can't give you any more details than that, other than that he's had back pain for many years. It's forced him to literally stop working as a dentist. He's young. He's otherwise healthy. He's in great shape. He wants to be a dentist, wants to keep taking care of patients, but he had to stop because his back hurt so bad. He found Duke Spine Institute online and contacted me. He and I did a Zoom call, which we offer free to anyone who wants it. Thank you. And during that Zoom call, I believe it was a Zoom call, I diagnosed his back pain to be coming from two discs, L4-5, L5-S1, and one facet joint, the right L5-S1 facet. Unfortunately, he has gotten other treatments, invasive treatments, before he came to Duke Spine Institute, and those treatments have not worked. He has ongoing back pain. He had a laminectomy, discectomy, where they remove normal bone and ligaments and muscle, and you're going to see some evidence of that during the surgery. If you have questions, feel free to ask me. We're going to get started. This is going to be a left approach at 4-5, a right approach at L5-S1. So if you have questions, ask. You can see the scar right there from his discectomy, laminectomy. I'm going to give him some numbing medicine right now on the left side so I can get to the L4-5 disc. I'm going to give him some more numbing medicine on the right side. You're okay to get to the L5-S1. We're just getting started. Everything's okay. Left 4-5, everyone agrees. Shot. Okay. Put a little numbing medicine in for my anesthesiologist. Shot. Very nice. You can see L4-5. Jordan, why don't you show the audience the L4-5 disc that we are trying to get to? That's right. Where's the target, Jordan? You guys see the white arrow, Henry?
Yes, we do.
That white arrow is where the back pain comes from. It is a posterior annular tear. And this patient, as I said, is a dentist, very experienced dentist. And I love dentists because of all the types of doctors out there, dentists understand pain. And by the way, people who go to the dentist, they understand pain too. So let's talk for a moment before we go into our video about pain. When you go to the dentist and you have pain in your teeth, right? There is a very perfect, limited, specific number of causes of pain, right? You can have a cavity. You can have an infection that goes down into the root canal zone and gets into the bone. So there are very specific causes of pain. And dentists are trained to identify them and fix them. So just like a cavity, and a cavity can affect, how many teeth do we have? We need to ask our dentist. 32 teeth. I think that's right. Is that correct? I don't know. I'm a brain surgeon, not a dentist. But you have 32 teeth, right? So all 32 could have cavity. But here's what's fascinating. Not all 32 teeth are equally likely to have cavities. It turns out cavities are more likely to occur with certain teeth, between certain teeth and on certain teeth, okay? And that's very important to understand. So just like certain teeth are more likely to have cavities that cause pain, and just like pain comes from very specific conditions like cavities, the back pain is the same way. We have very specific conditions that cause back pain, and it's my job to figure out where the patient's back pain is coming from. And that's what Duke Spine does better than any doctor in the world. How's blood pressure? All right, if we can get it down just a little, that would be great. So we are already in position on the left side at L4-5. We're working on L5-S1 on the right side. And I'm going to take a few more minutes to get here. Meanwhile, Henry, would you mind sharing with our audience the 30 different things that can cause back pain? I'm Dr. R. Deukmejian with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmejian. Thanks for joining us. All right, folks. So what you're watching is history. You are watching the most advanced spine surgery in the world. We're about to get started. Our patient is a doctor. He's actually a dentist, and he's from Florida. Now, what do we know about dentists? Dentists can help us get rid of the pain we have in our mouth, right? So if you have a cavity in your teeth, you're not going to be smiling, you're going to be frowning. And just like the cavity is a very specific spot on one tooth, the dentist has to go in and clean it out, debride it, and then fill it. We're going to do the same thing, except we're not fixing this patient's teeth to get rid of his back pain. We're fixing his discs to get rid of his back pain. Now, Henry, let's show the audience how a disc injury can cause so much back pain.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. You can see from our video how an injury to the disc will be so painful by creating what's called inflammation. It's the same thing that causes your teeth to hurt, inflammation. Now, what causes your teeth to hurt is inflammation, but that's inflammation that's caused by an infection of your tooth, right? So if you get a small infection, bacteria growing, it eats through the enamel, it starts getting into the root and causes horrible pain in your tooth. But it's not all your teeth that hurt, it's the one. And it's the dentist's job to use x-rays and other tests, like, poking around in your mouth with a probe to figure out which tooth has the cavity. So they use visual inspection, they use x-rays, they use poking, and between those three things, the dentist can identify which tooth has the cavity. Then they go in and treat it. It's the same thing for back pain. We just showed you a video that Duke Spine created. We're the first in the world to identify the causes of back pain and the frequency of back pain. And the most common cause of back pain is a disc tear in the back of the disc. It's called a posterior annular tear. That is the treatment, that is the diagnosis that this treatment fixes. And we've been doing this for 20 years. So we have been fixing annular tears just like dentists have been fixing cavities. We've been fixing it for 20 years. Now, we've been trying to tell all the other doctors about these cavities that happen in the disc, but nobody listens. Isn't that crazy? How we know what's causing back pain, and we're trying to teach the other doctors, but they don't want to listen. Instead, they don't want to drill and fill your cavity. They want to take all your teeth out and give you veneers, right? Isn't that what it's called, veneers? Huh?
Veneers go over your teeth.
Oh, okay. What are the fake teeth?
Dentures.
Huh?
Dentures.
Denture? No, that's not. Is it dentures? Huh? Implants. This guy does implants, by the way. Well, this is... All right, so the point I'm trying to make is, if all you have is a small little cavity, isn't it better to drill and fill it, and that's the best treatment where there's no complications and it's quick and easy and cheap, rather than pulling all your teeth out, not knowing which one causes pain in your mouth, and just putting in implants in every single tooth, all 32 teeth implants? That doesn't make sense. But that's what's happening with spinal fusions today. Artificial disc, spinal fusion, spinal cord stimulator, those are treatments that don't identify the cause of the pain, like we've just done, and don't treat the cause of the pain. They treat everything. And the point is they don't work, and they cause complications. And they're expensive for the patient, expensive for the insurance, expensive for everybody cost-wise. This is extremely cheap to go straight to the source and fix it. The patient was just awake. We did a discogram, evocative. He had 10 out of 10 pain at L4-5 and L5-S1. So my diagnosis was correct. It is these two discs plus the facet joint, and we're going to fix those. When he wakes up, that pain will be gone. The surgery takes about 30 minutes to do. Patients spend 30 minutes recovering, maybe an hour at most, then they go home. I mean, what better than that, right? Any questions?
No current questions, so we do have a comment coming from Pawn Lust on YouTube.
Pawn lust.
saying you're right that it's 32, and yes, it is interesting that they don't suggest deep breathing or cold showers for tooth pain.
Right.
It's viewed much more mechanically or in terms of infection.
That's right. That's right. So pawn lust, you are correct. Isn't it laughable? I mean, we call it laughable when they're trying to treat this disc injury with physical therapy, deep breathing, cold showers, anti-inflammatories. It's basically a zone of inflammation, just like a cavity, and there's only one proper treatment, and it is the Duke laser disc repair. It's what we're doing right now. So instead of debriding a cavity, we're debriding a disc tear. It's no different. It's a tiny little spot, but once you identify it, the pain all goes away. Once you fix it and identify it and fix it with the proper treatment, the pain goes away. There's no need for cold showers or jaw massage or pain meds. Those are not the right treatment. If you have a cavity that's painful, you must drill and fill, period. And the Duke laser disc repair is the drill and fill for back pain. Except other doctors don't know about it. That's the problem. And they don't know how to perform it. They don't know how to diagnose it. So imagine going back 300 years to when dentists had no clue what a cavity was, right? So mouth pain was a mystery, tooth pain was a mystery as far as what's causing it, and they had no way to treat it because they didn't know what caused it. So of course they couldn't have a treatment. Duke Spine Institute is the first in the world to diagnose the causes of back pain, and consequently we become the first in the world to develop the cures to back pain. And they're very simple cures, okay? And we've been trying to show you guys for 12 years videos of our surgeries of how we do this. And, it's very slow. The word is slowly getting out, but it's very slow. We want to speed it up. Any questions?
No current questions, so we do have another comment from Karsten on YouTube
Hi, Karsten. I think we've heard from you before. Welcome again.
saying other spinal treatments rely on solutions made from companies that has big name lawyers to help if problems.
100%. Karsten is right. That is a great thing Karsten just said it better than I've ever said it. Other solutions are developed by big companies that make big profit on over-treating the patient. And those treatments never fix the patient's problem, but they keep the patient in pain so the corporations can keep making money on multiple treatments that are unnecessary and don't work. But they keep billing the insurance and making money off the insurance. That's right. That is the problem. We need people to understand, forget about those treatments because they don't work. Come here and get the right treatment. Get the drill and fill of the cavity that's in the middle of your back. All right, so without questions at this time, why don't we show the audience why the Duke laser disc repair is the best treatment for a painful back when the pain comes from the disc.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. And was that really Duke laser disc repair versus all other treatments?
Oh, no, that was how to cure discogenic lower
yeah,
back pain.
well, we do have to cover that too. So All right, well, you can see from the video animation the way this surgery works. Very simple. The pain is coming from a small tear, just like a small cavity eating into the tooth, causing horrible pain. This is inflammation eating into the annulus, or basically the tooth of the back, which is the disc, okay? And the only way to get rid of it, the pain, is to get rid of the source of pain, which is the inflammation. And that's what we're doing right now. That's what that video just showed you. The Duke laser disc repair is the only treatment in the world that goes after the source of pain in the disc, which is the annular tear and inflammation within the tear. That's what we're doing right now. That laser fiber is 1 millimeter wide, 1 mm wide. That's how tiny it is. This scope tube you're looking at is 5.5 millimeters wide. So it looks big, doesn't it? Because we have magnified it using an endoscope. An endoscope is a special surgical tool where you have a system of lenses and light, and you have illumination and magnification. The lenses magnify the surgical image, making it easier for the surgeon to see what they're doing. This is so magnified that that 1 millimeter laser fiber looks humongous, right? It looks like a pool cue. Anybody know what a pool cue is? We got some pool players. All right. You play, what kind of pool you play? 9-ball? I like 9-ball too. Used to play a lot of 9-ball in college. All right, here comes a piece of herniation. Very nice. Yeah, I love pool. It's really a game of skill. It's, for those of you who don't ever play pool, try it. I mean, the amount of planning you have to do with every shot is quite amazing. Pool, great game. And if you like movies and you like pool, The Color of Money, right? Richard Newman, Tom Cruise. Am I right? That's an oldie. That was a great movie, folks. What was that, from like the 80s? I think it was from the 80s. It's one of Tom Cruise's first movies. All right, Henry, any more questions?
Yes, we just got a question from Mike on YouTube
Sure.
asking, I have neck and shoulder pain for years. One surgeon wants to fuse C3 through 5 because of
God.
pinched nerves. The other is sure it's because C23 is unstable and wants to fuse C2 through C4. Is it common to have two completely different diagnoses? I already have a fusion at C5 through 7.
All right, so yeah, let's talk for a moment. First of all, to answer your question, is it common to have two different diagnoses? The answer is, first, you have to understand this. You don't have a diagnosis, period. Neither of those doctors have given you the right diagnosis. A diagnosis, by definition, is not an opinion, it is a fact. And those doctors have given you their opinion, and their opinions are both wrong, I assure you. Therefore, you still do not have a diagnosis. A diagnosis is the actual cause of your symptoms. And those doctors are both wrong about the actual cause of your symptoms. So you do not have a diagnosis, and you don't have conflicting diagnoses. You just have two opinions that are both wrong. If you want a diagnosis, my advice is go to dukespine.com, fill out our free MRI review form, and I will tell you exactly what's causing your symptoms. And it's not a pinched nerve. That I assure you. And you don't need a fusion, by the way. That I assure you. We can do it without fusing you. Okay? Sorry to be the bearer of bad news. All too common problem today. People go to the doctors, they get different opinions, but they never get the diagnosis. Will you send Margie an email?
Copy.
Look at that herniation. Send Margie an email. I want a blog on diagnosis, medical diagnosis versus opinion. The difference. That'll be the title. Diagnosis versus opinion. Okay? What's the difference? And then I can explain it to her. but it's important. It's something people need to understand. All right, just about done with this one. That piece of herniation just kind of popped out of nowhere from the side. I can't just ignore it. I have to fix it. Damn, it's not coming out easy either.
That patient is doing well. He's up in the chair.
All right. Yeah, our first surgery for today, that guy was so happy. He was from Wisconsin. He and his wife were in shock of how good he's doing from his surgery already this morning. He was telling me he's going to tell all of his friends that have back pain about us. He said he's had a lot of surgeries in his life. He's an older guy. How old was he? In his 70s, 80s?
Yeah, he was like 78.
78. He's had a lot of, he said he's had 12 surgeries in his lifetime. And he's said this is the best surgery he's ever had out of 12. Any other questions?
No current questions.
Well, in that case, have we shown our audience DLDR versus other treatments?
We have not.
What do you think about that, Henry?
We can.
Oh, by the way, we just did a video. Henry did, I think, one of his best jobs. Me personally, I loved it, on Tiger Woods. Why don't you share the link to your new Tiger Woods video that you just edited
Copy.
and produced? I'm just about done. I got to get the last of this. Actually, you can't. Can you show the Tiger Woods video?
I can. It's just going to have to give me a minute.
It's going to have to what?
Just give me a minute to
Oh, yeah,
get it on
yeah.
here.
I think that would be kind of cool. Thank you. All right, just about done. Man, this, whoa. All right, that was weird. Went dry for a second. How come sometimes when we switch irrigation, it goes dry, very rarely, but other times it doesn't? Luis? Huh? It's not dry. It's not dry. It's fine. I'm just asking why sometimes it goes dry for a second and other times it doesn't. That's right. I know the answer. But what I'm asking you to is to fix it so it doesn't go dry. So switch it up properly. I do a lot of that, asking questions that I already know the answer. Just want you guys to come up with the answer. All right. So did you guys have fun with me in here with sleep on Friday? Huh? My testicles were pretty sore the next day. Who was twisting them? Luis? All right. I think that's good.
I'm
Well, let's
Dr.
get this last
Arjik
bit right here.
Majan,
Why
and I'm
does
here to
this
talk
keep
to you
more
today
keep coming?
about Tiger Woods and his story and his battle.
All right. We're set to go with the Tiger Woods video.
Well, do you want to play it or not?
We can.
I love it, man. I think it's a great video.
Most certainly can.
Do it.
All right.
I'm Dr. Arjik Majan, and I'm here to talk to you today about Tiger Woods and his story and his battle with chronic lower back pain. Chronic lower back pain is one of the main common reasons people go to the doctor worldwide. There are 1 billion people worldwide suffering with chronic debilitating lower back pain. Tiger Woods is just one of those victims, and this is a story about how back pain ruined Tiger Woods' career and literally took away billions of dollars worth of value from his professional career as a top golfer and celebrity in the world. Now, Tiger Woods' problems with lower back pain started well before his first surgery in 2014. Tiger Woods had a microdiscectomy performed. Now, microdiscectomy is a procedure that's been around for years. We've stopped performing them at Duke Spine because they are too invasive and they do destruction to the spine. It wasn't long afterwards, because he kept complaining about back pain, that he ended up having having a second microdiscectomy shortly thereafter. So he had 2 microdiscectomies. Now, this is an invasive procedure where muscle is being cut and destroyed, and that's why people need painkillers after the surgery, like narcotic painkillers. Tiger Woods had his experience with narcotic painkillers. He ended up getting addicted to them, and he ended up having problems, including a DUI, that were related to the use of opioid narcotic painkillers after his back surgeries. So you might ask yourself, well then why did Tiger Woods, this famous golfer who's got clearly enough money to afford to go to the best surgeon in the world, why did he end up with a microdiscectomy? And the answer is, all too many doctors out there, even famous doctors like the ones that Tiger Woods went to, they don't know about the advances there are in spine surgery because they sort of learned how to do the surgeries like microdiscectomy back in their residency training years, and they've just stuck with those procedures. And they also knew that if this didn't work, the microdiscectomy didn't fix Tiger Woods' problems, he could always come back and get pain management, shots, pills, radiofrequency ablations, and eventually he would end up getting a fusion, which is exactly what happened to Tiger Woods. He had his fusion in April of 2017. He had what's called an anterior lumbar interbody fusion. So if you look at the spine, the lower back has a series of bones and discs between the bones. An anterior lumbar interbody fusion is where the surgeon goes through the belly, moves all the intestines over, and basically cuts the disc out through the front, puts a cage in there, and then a plate. So ALIF is not a surgery that's recommended much anymore. There's a few surgeons who still do it, and maybe Tiger Woods chose a surgeon who did ALIF because that was sort of an older, more experienced surgeon. The problem with going with older and more experienced is often that they don't keep up to date with the newer technologies. Medicine is driven by technology, and the newer technologies often afford patients better options for care. Unfortunately, Tiger continued to be plagued with back pain. He ended up having another microdiscectomy performed next to the fusion because fusions cause a syndrome called adjacent segment disease, and that's where you fuse one disc in the spine. For example, the L5-S1 joint is fused, and that puts additional pressure on the L4-5 joint. That causes the joints above or even below the fusion to become painful and wear out very quickly. That's what happened in Tiger Woods' case, and again in December of 2020, he had a third microdiscectomy surgery. So after that procedure, shortly, a few years later actually, he ended up getting a disc replacement. So in October of 2025, just last week, Tiger Woods had his 6th back surgery, and he continues to suffer with back pain. So let's take a moment to think about the toll that chronic back pain has taken on someone like Tiger Woods' life. And I'm going to tell you this is a very common scenario that we hear about over and over again in patients with chronic back pain. They start to treat their pain with conservative treatment like pain meds. They end up getting addicted to the pain meds. They end up needing more pain meds because the pain meds they were taking lose their effect over time. This is a phenomenon called tolerance. It's well known and established when it comes to pain medication. We become tolerant to pain medicine just the same way we become tolerant to alcohol. If you drink alcohol every day, you find that it doesn't have the same effect. You need to increase the amount that you're drinking. You go from 1 ounce to 2 to 3 ounces to get the same effect. So people develop tolerance to pain medication, and Tiger Woods did. As a matter of fact, when he was involved in his DUI in 2017, he was on hydrocodone, hydromorphone, which are both narcotic painkillers. You should only be on one at a time. He was on 2 because the pain was so bad. He was also on alprazolam. Most of you know it as Xanax. It's basically to calm your anxiety. So it turns out people with back pain have anxiety problems. They have depression. They have all kinds of mental health issues because they're suffering with back pain. They're not sleeping well. Their life is destroyed. His career was destroyed. He could not do golf. He couldn't be successful. He couldn't perform like he was supposed to. And you have all this pressure on you to perform from your sponsors, from your friends, from your family, from your spouse. So Tiger was under tremendous emotional, personal pressure, anxiety, depression, and the medications he was taking, this alprazolam, for example, it tends to cause depression. So do the narcotics. They cause depression as well. So he was on an antidepressant at the same time, zolpidem, and he was also on THC. So basically, we call this polypharmacy, where patients with a chronic medical condition are trying to find some way to alleviate the symptoms and how the effect of the symptoms are on their life. So they end up trying all kinds of different drugs. And the next thing you know, they end up either dead because they've overdosed or they end up in an accident like he did. So I really feel that it's important that you all know that there are better treatments available, but you will not hear about these treatments from most spine surgeons or pain management doctors because A, they don't know about them, or B, they're not making money off the treatment. So they're going to recommend the treatments that they're going to make the most money off of, which are the ones that they can provide you, not the best treatments for you. Every patient at Duke Spine Institute comes in and has one back surgery for their problem. If you have a bad disc causing pain, we go in and do laser, and that's the last time you're going to need surgery on that disc. Now, some people end up with other problems causing back pain, like piriformis syndrome, where they have a tear in the piriformis muscle that causes horrible back pain. And the way we fix that is with the Duke piriformis release. That is very successful at eliminating back pain from a piriformis muscle tear. There's also sacroiliac joint pain, or sacroiliitis, as most of you might know it, where we can go in and basically destroy the pain nerves to the joint, permanently eliminating back pain. Finally, there are facet joints. Facet joints are not well known by most people, but they're a small joint in the back of the spine, and there is no effective treatment at eliminating facet pain permanently except for the Duke plasma rhizotomy, another patented treatment available at Duke Spine Institute. To learn more about the Duke laser disc repair, please visit Duke Spine Institute's website or our YouTube channel and hear from the hundreds and hundreds and hundreds of patients we have cured over the years and eliminated their back or neck pain. You can also follow us on our podcast. Have a great day. Thanks.
Welcome back. We are at L5-S1 on the right side. This was the most painful disc for the patient. When we tested it earlier, he had a 10 out of 10 here. This is the disc that he had the microdiscectomy done. You can see all the junk here, bone spur right there with the laser, and then scar tissue right here, the white stuff that I'm zapping. That is the annular tear. That's where the, it's the nidus or source of pain is right there. And before I started zapping this, it had a lot of pink inflammatory tissue. You guys could see it down in the bottom corner. So this is the most painful part of his back pain right here. There's some more right there. Look at that inflammatory tissue. That should be white, folks, pure white. This is where he had his microdiscectomy. The problem with microdiscectomy is it does not back pain. It is not a good surgery. We do not recommend it. He had a microdiscectomy and he's in more pain now than ever before, but we're about to change his life and put him back to having a normal life and having a relationship with his wife again, going back to practice and taking care of patients and fixing their mouths and putting smiles back on their faces, because that's what dentists do. God knows I had trouble with my teeth. I remember when I was a resident in neurosurgery, I was poor, I had no money, and a dentist drilled and filled a cavity in my mouth that was hurting so bad. I didn't have enough money to pay. I think it was like $800 and I had no money. And they did it for me and they helped me. So I have a special place in my heart for dentists that help people. And he's one of them. He's going to get back to helping people. Also, my entire West Coast family is dentists and orthodontists and OMFS. They all they do is fix people's teeth in Los Angeles. So I have all my cousins and basically cousins that are all dentists and OMFS and reconstructive surgeons in Los Angeles. So I don't know much about dentistry, but I know a lot about having family members that are dentists. I'm starting to sound like one of those liberals that talk about, wasn't it Mondami who was saying that his aunt had a problem on the subway? And then it turned out it wasn't his aunt, it was like a distant cousin. They're making fun of that. Right? You know what I'm talking about? Thank God you're back, Nikki. Thank God. Somebody's got to laugh at my jokes. Somebody. All right, we are done. Henry, is there any other questions or comments?
Yes, we have one more question coming from Karsten once more on YouTube asking, do you agree that people with back pain need to relearn how to use movement that involves moving while moving the whole spine and all movements versus just move parts of the spine?
Yeah, of course. I agree with you, Carson. But that is not going to cure their back pain. But the problem is people with back pain that's chronic, it changes the way they walk, the way they stand, the way they move, and it makes it worse, not better, worse. And so when we go in and fix them and get rid of the back pain like this patient, they end up with all kinds of bad movements, right? Just like my golf swing. And you need somebody to teach you, how to do it right again and to basically fix those bad habits that you've developed while you had the back pain. That's why it's important, if you have back pain, fix it early. Don't wait years to get it fixed. Don't wait until it's ruined your posture, your life, your health, your business, your relationships. Fix it early. This is all scar tissue right here. A big chunk of scar tissue from his prior microdiscectomy. Okay, big chunk of scar tissue right on the herniation there. You guys see the blue herniation?
Yes, we do.
That, obviously, the microdiscectomy doesn't fix the source of back pain. Only the Duke laser disc repair does. I've got 1 minute left, so if you have questions, type them up. Otherwise, we're done. This is our last case for the day, correct, everybody? Yes? And are we going to be back next week with more fun? Yes? Huh? Yes. All right. Folks, thanks for joining us. We got about 30 seconds left. Look at all this scar tissue right here from his prior surgery. Avoid microdiscectomy. This is from microdiscectomy. It's bad. It's literally wrapping around the nerve that's in the foramen. It doesn't cause back pain, but it will cause your leg weakness, numbness, and tingling, and even some sciatic pain. Look how nice the laser cuts through scar tissue. You guys see that? Beautiful. There's no tool that does a better job. All right, we are done. Henry, any other videos we need to show?
Other than the Duke laser disc repair versus all invasive back procedures, other than that, nope.
All right, well, why don't we finish with that? Since we're pretty much done here, I'm just grabbing out the last few chunks of material. And let's go ahead and end with that since there are no other questions.
Hi, I'm Dr. Duke Machen. We've just completed our free MRI review at Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Duke laser disc repair. We've been performing the Duke laser disc repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Duke laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Duke laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Duke laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Duke laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Duke laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Duke laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Duke Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest,